Hello people, welcome back to another video where today we're gonna be reacting to Dr. Dan, um, Dr. Dan will be reacting to Chicago Med. The reason why I'm doing this reaction is because to point out things I learned because um because uh people might have doing different things. So let's go around and react.
Back to my channel, it's Dr. Daniel Choi. I have a special guest here today, none other than my wife and fellow medical colleague, Dr. Jennifer Park. Dr. Park, would you like to introduce yourself?
Sorry guys, stupid dog is barking.
Hey guys, welcome back to my channel. It's Dr. Daniel Choi. I have a special guest here today, none other than my wife and fellow medical colleague, Dr. Jennifer Park. Dr. Park, would you like to introduce yourself to our wonderful audience?
Yes.
Oh, let me introduce yourself. That's one thing I forgot to do, and I always forget to do. I'm nurse aide or nurse assistant. To love. I'm in Kansas. Sorry if y'all can't understand me. I got a German accent. So, anyway, let's get on to it.
I'm Dr. Park. I'm a board-certified internal medicine doctor, training in hematology.
Oh yeah, and I'm also board certified. So.
And I'm here to assist Dr. Choi with this reaction video today, so it should be fun.
And I'm going to assist him with a reaction video. So, it's kind of like a assist thing.
So today is not just a doctor reacts video, it's a doctor couple reacts, and we are doing Chicago Med. I had a special request in the comments for this specific episode in season 4, episode 4. Let's get started.
Okay. That's I always like it. One thing I always is seeing is people working out. So to work in medical field, we have to like take care of yourself and like we'll have to have like muscle and strength to lift patients, because some patients is heavy. So let's get back onto it.
Nice spot. All right, so do you like the show already?
I do.
Yeah, obviously. So this is Dr. Choi, one of the main characters. It looks like he is practicing good physician wellness, and this is
which is also important for certified nurses assistants. We'll have to have a good wellness to be any healthcare worker or caregiver or healthcare provider.
something that doctor burnout is a huge topic these days. The job itself is super.
Let's not forget about nurse burnout. Like nurses get a lot of burnout.
Stressful, so when we go home, we try to do various hobbies or physical activities to try to get that stress out.
Yeah.
Same with nurse assistants or patient care techs or whatever. They all mean the same thing. They mean all nurses.
I think self-care is really important because you really can burn out very easily with all the sick patients you take care of. So I agree.
We can. I don't know how many people gets burned out in my area because of sick patients and not taking good care of themselves. Tons of people in my area get burned out.
Yeah, and I definitely try to work out like Dr. Choi every single day.
Every day?
Not every day, but some days.
Yeah, same. I don't I'm not a big workout. I'm just exercise, like stretch, walk. I do sports. So yeah.
Someday. I try.
Whoa. Dr. Manning. Oh my God. So Linda's upper body is covered in bruises. There's also
Oh my
petechiae.
gosh. That patient is fully bruised. Like, so I don't know what would cause it. Let's see what these people have to say if them say anything.
The small capillaries of her skin are inflamed and bleeding. I think it's all a result of something happening inside her body.
So, petechiae, this is something that orthopedic surgeons do not encounter. So I'm going to call in a consult here with Dr. Park. Dr. Park, what are petechiae?
So petechiae is a skin finding. You can see tiny little reddish, purplish spots, and it could be on your legs, your arms, your chest, and even in your mouth I've seen.
So particularly talking about red purple spots. When I was in nursing school for CNA, we talk about bed sores, pressure ulcers, which is someone sitting in a position too long and they putting a lot of pressure on it, and a bump can form on where them sitting because them being, and it's usually like a big it's usually, and it's also caused to, and the first sign of pressure also is skin breakdown, which will turn red. I don't know if it's bleeding under the skin, so I don't think them two is the same.
Common causes of that are you can have low blood cells as a result of something called ITP, which causes low platelets.
So what is ITP for my simple orthopedic brain?
ITP stands for immune thrombocytopenic purpura, and commonly you can see when the platelets are extremely low, you can see the skin findings on the legs and in the mouth.
I see. So low platelets, right, is the cause of ITP, right? So what is the function of platelets?
There are white cells, there are red cells, and there are platelets. Platelets are important to help you to prevent bleeding.
So the whole thing...
Platelets is another name for basically platelets form clots, which prevents bleeding out um or blood from exiting the body.
It's like you're seeing these little red spots, I guess, on this patient's skin, and it's a sign that her blood clotting is not working properly, right? So our body needs to form blood clots to prevent abnormal bleeding, and this patient's having abnormal bleeding in her skin. All right, let's go on here.
44-year-old female complains of lumbago. Pain 10 out of 10. HPI symptoms first presented.
Info. I was getting dressed for work, bent down to put on my shoes, and my back locked up.
So, lumbago is a pretty common condition I see, and 80% of Americans will actually experience lumbago. And what is that? That's actually just low back pain, or axial back pain, we call it. Anything can cause it. It's usually not a serious cause. People show up in my clinic all the time, and they're worried about tumors. They're like, oh my gosh, I have a back tumor in my back. Sprain, a muscular sprain, or something very simple that usually some physical therapy, some medications will take care of, but it is a common condition that I see as an orthopedic spine surgeon.
As a CNA, I really don't see any thing he's describing. Usually because I'm new to the field, that which can have something to do with it.
Well, why don't we take a look? Is
Is it okay if student Dr. McNeil examines you?
Have you done this before? Oh, wonderful.
I'll be gentle.
Guess you can't make the pain any worse.
All right, so this scenario here where the medical student actually gets some shade, I guess, from the patient. What do you think about that?
I understand her concerns because she's in a lot of pain and she wants to be treated right away, but I think it's important at an academic center to be able to let medical students examine.
Usually, if a patient is in it, so as a CNA, I can't give medications. So if a patient or a resident or someone I'm taking care of asks for medication, I can't give medication. Which is I have my scope of practice, and I can get my license and certificate taken away. So as a CNA, we can usually be like go find a nurse, the charge nurse, or someone who can give medications. It can also be a CMA, but them can give pills. So I would be like, hey, patient Mr. Bob in room 111 needs pain medication. So that's how CNAs that's how CNAs do it. If a patient asks for medication. Man, I can't talk.
So it's definitely something that both Jen and I went through in medical training, where walk in when we were medical students and the patient would definitely kind of throw up their eyebrows,
Here,
be like, oh my god.
fix first came. There you go.
Some medical students here to examine you, and it doesn't happen with most patients. It usually just happens with a few patients, and most of our patients where we're training at academic centers, they typically understand that there's going to be students and residents.
So as a CNA, when I went to like training, I don't know what type of training he's referring to, but the training that I'm thinking of is clinicals, and I didn't actually have like actual patients because of the virus. I had in-house clinicals which will go to the facility and which will go to the facility that is enrolled to, and will do clinicals there.
And
That's the only training I could think he's talking about.
usually
I see a surgical scar.
Discectomy.
L4, 2 years ago.
Press against my hand like a gas pedal.
It hurts. Stabbing pain. We have to do the other leg? It's gonna hurt too. So will flexion, extension.
Been down this road a
So, typically after a discectomy, patients can have residual pain. I think the medical student here did a good job examining this patient. He was asking her to push her.
I think the medical student also did a good job asking questions and examining the patient. The only way to be a good medical student is ask questions, and answer questions. If we don't know the answer, find someone who does. That's not the only way how to become a good medical student. I'm sure we can find videos on YouTube about how to become a good medical student.
Foot down and pull her ankle up, which is a motor exam in the neurologic exam. It's actually part of the exam where they're testing muscle strength, make sure that all the nerves are functioning properly.
When I was in the EMT class at my high school, we actually we actually told the person, hey, can we push forward? Can we squeeze my fingers? Can we like push down, push up, to test century and the other things I can't remember. It's been so long.
So I think the medical student did a good job here with the exam.
Good job, medical student.
Been down this road a few times.
Today's the worst it's ever been, though.
What would you suggest?
CT? 5 of Valium for the spasm?
Oh, that's you.
So what would have been your next diagnostic test? Would have been a CT or something else?
So I actually think a CT is not an unreasonable first step here. Typically, I prefer MRIs, but it depends on the condition. So CTs are typically used to see bone and actually.
And as a CNA, I don't we have to get trained and certification. I don't know a CNA that actually use a MRI or a CT or whatever. If we know a CNA that uses a CT or a MRI, go ahead put it in the comments.
Like hardware, if someone has pedicle screws or screws and rods in their spine surgery site, then a CT might be more helpful to evaluate that. But an MRI is more helpful to evaluate disc problems or soft tissues, and it looks at different things. So here I think a CAT scan is not an unreasonable thing to ask for. The first medication they administered was
and when I had both of my knees before my knee surgeries, I went to the orthopedic and them use a MRI. So MRI can be used for different things. So can a CAT scan.
thing called Valium. It's an anxiolytic, so it helps with anxiety, but it also helps with muscle spasms as well. So there's other muscle relaxants that they can give, but I agree that that's a good first step here in the workup of back pain.
BP's dropping, down to 90 over 70. Heart rate's jumped, 130. Spleen is grossly enlarged. Also, free fluid in the abdomen, wasn't there on intake. Grab 2 units and then let's move.
I mean, she sounds pretty sick. Her blood pressure is falling. She has fluid in her abdomen. Her spleen's enlarged, I would think.
She could have I can't think of what it is. She could have like bleeding in the abdominal area, but I'm not a doctor or whatever, but I did take EMT, and which is another story.
That maybe she's bleeding into her abdomen from the spleen, possibly. I mean, it
I
sounds
was
pretty
right. I was right. Bleeding in the arm. I mean, I just went with my gut.
serious, so she's very sick.
What's the most common thing you think about when you have an enlarged spleen?
So as the story unfolds, she has petechiae, she has an enlarged spleen. I would think that there might be some hematologic disorder, a bone marrow disorder. It usually manifests with a large spleen.
She could have a bone marrow disorder. And so another thing about me is I took in a bunch of medical classes and healthcare classes, so got a bunch of healthcare knowledge and stuff.
Some abnormalities in your blood count, so that would be my highest suspicion. But I think you need more of a definitive way of diagnosing this.
Okay. Let's see what happens.
I need some help.
What's going on?
She's bleeding internally. We need to get her up to surgery now to control it.
She'll be okay though, right?
So one thing about Hill is if I heard someone ask, she would be okay white. Okay, like the dude asked if she would be okay white. Don't ever be like, oh yeah, because we don't know if the person will be okay. be like, hey, we will do everything in our power to fix it and help her in any way in our power. Don't promise nothing that we don't know what will happen.
This is a pretty intense situation. It looks like she's getting run up to the operating room to get whatever bleeding is happening under control. So usually that involves some type of what we call an exploratory laparotomy, where they make an incision in the belly, open up all the abdominal contents where they can examine even the spleen, and to see where that bleeding is coming from, they can control the bleeding intraoperatively. Now, interestingly, what I noticed here, the patient's family asked, is she going to be okay? The physician here, she didn't respond at all.
Sorry, I had to do something real quick.
What do you think about that?
She's pretty sick, so it's hard to tell how the surgery is going to go, or if her bleeding is going to get worse, her blood pressure is going to drop. So it's going to be hard for the family to take in when she doesn't respond. But I think that's her way of saying that she won't know until after the surgery.
Yeah, absolutely. In medicine, there's absolutely like zero guarantees, right? I take my patients into surgery and they're asking me, is my mom or dad going to be okay? And, you know, for the most part, I wouldn't not respond. I don't think that's appropriate. I don't think I would just like shut down and not say anything. I think you need to reassure the patient, but we are also very detailed in talking about the risks of surgery, and for you,
the risks of chemotherapy and the outcome, the cure rates and all that. It's not an easy
So, like I
conversation.
said, we never want to promise anything in the medical field if we're working, because we don't know the outcome. Outcomes can change can go from 0 to 100 or 100 to 0 real quick.
But I think in this situation I understand because it's an emergency. So they don't have the luxury of time that we do.
exactly. So she's rushing her off to the OR, and there may not be necessarily enough time here to talk about all the details of surgery. They just want to make sure her bleeding stops.
You can't shake the bruising and petechiae and now your spleen. They're from primary myelofibrosis. It's a type of leukemia.
Oh my God.
Leukemia.
So leukemia is a type of cancer. There's multiple types of cancer. So
Cancer. It is.
Primary myelo something. What was that?
Primary myelofibrosis. It's a condition where there's scarring in the bone marrow, and that can result in abnormalities in your blood counts. And in her case, it looks like her platelets are really low. So that had led to the petechiae that we had discussed before. They're actually produced in the bone marrow, and if there's scarring, production may be abnormal due to that.
So my simple orthopedic mind gets pretty confused. So we're going to go down to the basics. So what kind of cells does the bone marrow produce?
We discussed the white cells before. They're important for fighting infections. The red cells are important for oxygenating all your organs, including your brain and your spine. Platelets are also produced there.
What is leukemia?
So leukemia is an abnormal...
So leukemia, from my understanding, multiple people. I took multiple medical courses, and when we studied leukemia that much. Let's go ahead and see. I could be wrong about leukemia being a cancer, but here we go.
Normal growth of the white blood cells, where mutations had caused this abnormal clone to grow.
Yep. So, so I was wrong. So I was thinking of, I was probably wrong. So I was thinking, so cancer, leukemia is when, it is cancer. Okay, never mind. Because it says, so more or less it's white cells, body, so what kinds of with the cancer of the body, blood forming tissues causing proliferation of the white blood cells, which means more white blood cells is being produced.
Proliferatively, causing the other cells to either go down or have abnormal function. Even though the white counts are higher, you would think Logically, higher
So
white
what you
count.
mean by white counts is white blood cells going up in numbers.
Or you have more of a defense for infections, but really it's the opposite. It's really dysfunctional, so you're actually predisposed to infections.
To be honest, guys, it's been a long time since I've studied leukemia, and I'm actually learning.
Same, it's been a long time. So, and when we don't study it that often, we'll lose it. We don't study, we lose it. So,
Not here. Don't tell her that, though. All right, let's move on.
That's good.
One treatment that can offer a cure. It's a stem cell transplant.
Transplant.
Jen, what exactly is a stem cell transplant?
So stem cell transplant is when you want to replace all your bad cells with good cells. And that can be from a donor like a family member.
Family member. Okay. All right, let's see what she does here.
Manny, as Linda's brother, you are the ideal candidate to donate your stem cells. It's a series of infusions to boost your bone marrow production.
When can he start?
Today. By the end of next week, it's likely you'll be able to donate to Linda.
He needs infusions to boost his bone marrow. What's going on here?
The brother, usually a family member, would be the best match because we have the same type.
family member will be the best match because I forgot the reason. Let's go ahead. Who
Blood cells most of the time, and you want to prevent any complications from an unmatched bone marrow transplant.
What kind of
So,
complications are you talking about?
graft versus host disease, where your cells may attack the implanted transplant. So
I see.
that would result in a rejection, and that wouldn't be a good outcome. Said the infusion would increase the amount of stem cells, so we can collect as much stem cells as possible to transplant into the patient.
What about Evan? He's the only other blood relation.
It's possible. Stem cells can also be extracted directly from Evan's bone marrow, but it's an invasive process. It would take multiple procedures to harvest the amount of cells needed.
Evan, it sounds like, is the patient's 3-year-old son, and she's saying that it wouldn't be a good idea to extract stem cells from the 3-year-old kid. Why? Why is that?
It's a difficult procedure to go through. Typically, you do numb the area, but in kids, bone marrow biopsies obviously aren't easy because they're a little less cooperative. So
and not to mention the bones. Them is small, so the bones is small. When we grow, bones become bigger, and it's more easier to extract bone marrow.
children, usually they might be under anesthesia.
And how's it done? Is it incision?
So you insert a large bore needle into the back hip area, and then you go in and you aspirate the bone marrow cells.
Okay, so the hip, like orthopedics.
Sort of, I guess.
All right, so it sounds kind of rough for a young kid to go through, a 3-year-old kid to go through. So it sounds like it's not going to work out here for them to use their son. So they're in a bad predicament here.
There's some referrals that I think you should take a look at.
No, I don't need a therapist or a new plan. I need my refill. What is the big deal? My God, I'm a lawyer with great insurance, not some junkie off the street. Give me.
So usually, when people say that, when a patient say that, then probably a junkie. Then probably want medication just for medication.
My prescription, or so help me, I will sue you in this entire emergency room.
No.
Get out and send me your boss.
Ouch. So
That's pretty intense.
It's pretty intense. So I have to tell you that scenario right there is one of the most stressful parts of our job and our profession as a doctor, and that is the problem of difficult patients, right?
Yes.
So, this doesn't happen often. We love our patients. All of our patients are usually amazing, but they're also under stressful situations sometimes, and sometimes tempers flare, patients get emotional, and they can become angry at you, right? And that's happened from time to time. How do you usually handle a upset, angry patient like this who's demanding and
He's right about patients becoming angry because they was really stressed and have health problems like dementia or behavioral problems.
Been threatening to
Oh, and dementia is usually in older people, older patients.
sue you on the spot.
In terms of dealing with a difficult patient, I think that you want to try to understand where they're coming from, and you want to try to help them understand where you're coming from and why, let's say in this case, prescribing opioids might be more harmful than beneficial. So I think that's where you have to kind of draw the line and hopefully have the patient understand where you're coming from.
Yeah, I think that the key is de-escalation. You know, in
Right.
these kind of situations, like I said, these patients are stressed out. It's not their typical self, and I try to give them the benefit of the doubt, and you try to de-escalate and come back at a later time when they're maybe not upset, so you can explain yourself. This is a pretty tough scenario where the patient's threatening to sue you. I mean, that's also a very stressful part of medicine, the fear of being sued, and she's really coming at these doctors, unfortunately.
And sometimes you may need help from other physicians as well to
Oh.
explain.
This is Coco right here, okay? This is Coco Puff.
Kind of in a more
Collaborative way.
collaborative way.
I compiled a list of immigration attorneys. Perhaps they can get
And usually patients that is agitated needs a little bit time to calm down. So we might want to step out of the room or talk in a soothing, quiet voice. We don't want to raise your voice at patients who is agitative.
released quickly or expedite Linda's citizenship so she has easier access to the transplant network.
That family came to us for medical help, and the best we can do is give them a list of lawyers.
I think this touches upon another complexity of medicine, and you know, this show is doing a good job of portraying some of the difficult parts of practicing medicine. And one of them is that just because you have a treatment to offer and you have a sick patient doesn't necessarily mean it just happens just like that.
Like, it's not always available to them.
Then there's also socioeconomic issues, there's insurance issues, and so medicine is increasingly becoming a more complex thing. As a physician, we'd like to just, your
And
chemotherapy.
that's why people say study, research, because medicine can change in a hurry. Medicine can one day a medicine can say, oh, so has this, or so many people can get this in couple days or whatever. Then the next week medicine says the opposite. So that's why we need to always learn and study.
I know my surgeries, and we just like to provide that to our
Right.
patients, but it's not always the case, unfortunately.
Ethan. Hey, you got a minute? Bernie, it's been a long day. I just want to go home and not think about anything.
I think we could both relate to this, right? Where
I can relate. So usually CNA is 6 to 12 hour shifts, depending on location and stuff, and things vary. Time varies, shift varies.
you're leaving the hospital and you are absolutely wiped from a long day of surgery or a long day on the wards. And what do you think about how Dr. Choi feels here?
I completely can empathize with how he feels. I sometimes just want to go home and just watch mindless Netflix movies or little episodes and just take the night off.
Yeah, absolutely. I mean, some days are great. Some days are awesome, right? Some days are amazing. They're
Right.
light. They're easy. But when you have a hard day, and you're emotionally invested in your patients, right? I
Right.
mean, I don't know how she does it, to be honest, because you're delivering bad news quite a bit, right? We've had lots of conversations about this where you've had a long, hard day of delivering bad news of cancer diagnoses to your patients, and you've also had patients you followed through their treatment care and they've passed away, right? And do you want to tell them a little bit more about what that feeling was and how you take a patient through a cancer treatment and then ultimately you can't save everyone?
No, you can't. And I come to realize it's not my fault, it's not the patient's fault, it's just a disease and it's disease course. So you can't do, it's really out of your control. It's a difficult field. You get attached to your patient and you want to see them cured. You know, every patient that comes to your door, you want to see them cured, but you know, again, it's not under your control. So, you know, you get attached to the patient. It's really, I mean, it's not easy.
Yeah, and I think that
usually usually she usually what she say is true on multiple, depending on what wood we're working on, whether it's the intensive care burn unit or ICU or critical care unit or hospice unit. Depending on the unit, there can be multiple who might have to deliver multiple bad news to family members.
we've had this conversation. We talked about how we have to focus on the positive, right? Even me, I have a surgery and maybe there's a
We'll have that's what we'll have to do. We'll have to focus on the positive.
complication and the patient doesn't do well, and so we can't harp on all these negatives. If you weren't there, what about all those other patients that you gave chemo to, that you saved, or you saved their lives and you brought them back to complete function, complete health? What about those patients? And so really in medicine you have these kind of situations you can't control, but you also look at you have to focus on the positive and all the good work that you're doing for your patients. Good job, wife.
Thank you.
She's doing a great job. She's doing a great job on this video, and she's doing a great job with her patients.
Thank you. And I do want to say that when you look at the big picture and you see how rewarding it is overall to, you know, get them to cure or have them live as long as they do.
Alright, I think I'm going this hill, cause I'm outside and I'm freezing, so I'm gonna go inside, and get warm up. Don't forget to like, comment, and subscribe, and have a good, and stay tuned for more videos.